When we assess immune function, it's not just about running a few lab tests. The process starts with a careful health history and physical examination. We want to know about the patient's nutritional status, past infections and immunizations, allergies, autoimmune disorders, cancers, chronic illnesses, past surgeries, medications, and even blood transfusions. Each of these pieces of information provides a clue about how well the immune system is working. The physical exam goes beyond vital signs. It includes palpating lymph nodes and inspecting the skin, mucous membranes, and the major body systems: respiratory, gastrointestinal, musculoskeletal, genitourinary, cardiovascular, and neurosensory. The health history always begins with age. Age matters because it shapes immune function. Gender matters too. Autoimmune diseases, for example, occur more often in women than in men. We now know that sex hormones play a direct role in immunity. Estrogen tends to enhance immune activity, while androgens are generally more suppressive. This explains, in part, why autoimmune conditions disproportionately affect women. In these diseases, hormone expression is altered, which leads to immune dysregulation. Age-related changes in immunity are grouped under the term immunosenescence. This describes how the immune system declines with age, leading to higher rates of illness and mortality in older adults. Bone marrow may not function as well, the thymus loses efficiency, and lymphocytes become impaired. Neutrophils and macrophages don't work as effectively, dendritic cells are less active, and T-cell activation drops. Hematopoietic stem cells lose their renewal ability, and overall phagocyte numbers and function decline. Natural killer cells lose some of their killing power. At the same time, inflammatory cytokines tend to increase, while the effectiveness of vaccines decreases. The result is an immune system that is weaker and less precise, leaving older adults at higher risk for infection, cancer, and autoimmune disease. As nurses, we must recognize the signs and symptoms of immune dysfunction across systems. In the respiratory system, be alert for abnormal breathing rates, cough, wheezing, crackles, rhonchi, or bronchospasms. In the cardiovascular system, look for hypertension, tachycardia, arrhythmias, vasculitis, or anemia. Gastrointestinal signs include hepatosplenomegaly, colitis, vomiting, or diarrhea. The genitourinary system may show frequency, burning, hematuria, or discharge. The musculoskeletal system may present with joint pain, swelling, or edema. The skin may show rashes, lesions, dermatitis, purpura, edema, urticaria, or discharge. In the neurosensory system, immune dysfunction can manifest as cognitive decline, headaches, visual changes, hearing loss, ataxia, or tetany. Recognizing these signs early can guide timely intervention. Older adults, in particular, require close monitoring. Their antibodies may fail to distinguish between self and non-self, increasing the risk of autoimmune disease. Their surveillance systems may not recognize abnormal cells, contributing to higher cancer rates. Postmenopausal women are at greater risk of urinary tract infections due to estrogen deficiency, incontinence, or urinary stasis. Other factors, like malnutrition, poor circulation, or thinning skin, add further vulnerability. Stress also plays a role, compounding the decline in immune function. This makes it critical to continually assess both physical and emotional status in older adults to prevent complications. Nutrition is a cornerstone of immune health. Traditionally, we focused on how nutrients supported host defenses and how infection increased nutritional demands. Now we know it's more complex. Nutrients like proteins, vitamins, minerals, and lipids directly affect acquired immunity and inflammatory processes. Deficiencies can impair cell function and weaken the immune system. Micronutrients, such as zinc, are especially important. Zinc supports homeostasis, apoptosis, and overall immune function, and deficiency has been linked to disease development. Poor nutrition not only increases infection risk, but also slows post-operative recovery and wound healing. Nurses must take a proactive role in assessing nutrition and educating patients on maintaining an immune-supportive diet. A thorough immune assessment also includes immunization history. Ask about childhood and adult vaccines, including influenza, pneumococcal, herpes zoster, pertussis, and measles or mumps. Education on staying up to date with vaccines is vital. Next, ask about infections, both past and present. Document the type of infection, dates, treatments, and outcomes. Assess for recurrent or persistent infections. fevers of unknown origin, lesions, or sores. Don't forget to ask about exposures to tuberculosis, sexually transmitted infections, or bloodborne pathogens like hepatitis and HIV. Recent travel and environmental exposures also matter. Allergies must always be assessed. Ask about environmental, food, medication, vaccine, and latex allergies. Note the type of allergen, symptoms, seasonal patterns, and any testing or treatments. Document everything in the record, whether paper or electronic, and continue monitoring for allergic responses. Next, ask about autoimmune disorders. These can affect any tissue and are often more common in women. Conditions like lupus, rheumatoid arthritis, multiple sclerosis, and psoriasis should be discussed in terms of onset, severity, remission, flare-ups, treatment, and effectiveness. Family history is also important, since many autoimmune diseases have genetic links. Cancer history is another key piece of immune assessment. Ask about personal or family history of cancer, types, age of onset, treatments, and outcomes. Cancer itself, as well as treatments like chemotherapy and radiation, are immunosuppressive. Large tumors may release antigens that neutralize antibodies, while tumor cells may block destruction by killer T cells. Hematologic cancers like leukemia and lymphoma directly affect white blood cell production and function. Chronic illnesses and surgical history must also be included. Diabetes, kidney disease, and COPD all compromise immune defenses. Kidney dysfunction lowers circulating lymphocytes and allows toxins to impair immunity. Poor glucose control in diabetes increases infection risk. COPD leads to recurrent respiratory infections due to ineffective airway clearance. A history of organ transplantation or removal of immune organs like the spleen must also be noted. Special problems such as burns further weaken the immune system. Burns compromise the skin barrier, deplete proteins, and increase risk of infection. Surgery and injury cause cortisol release, which suppresses immunity. Stroke is another important risk factor. Stroke-induced immunosuppression is strongly associated with post-stroke pneumonia, a leading cause of death in these patients. We also need to review medications and transfusion history. High doses of antibiotics, corticosteroids, chemotherapy agents, NSAIDs, and anesthetics can all suppress immunity. Blood transfusions may introduce foreign antigens, and though the risk of HIV from transfusions is now very low, it is not zero. Ask about herbal and over-the-counter medications as well, since many have unknown effects on immune function. Lifestyle factors are equally important. Poor diet, smoking, alcohol use, drugs, and environmental exposures impair immunity. Even positive habits like extreme exercise can stress the system. On the flip side, supportive strategies like mindfulness, yoga, humor, and relaxation can enhance immune resilience. Finally, psychoneuroimmunology reminds us that the immune system and the brain are interconnected. Stress and psychological illness influence immunity. Lymphocytes and macrophages can respond to neurotransmitters and hormones, while brain cells respond to immune signals like prostaglandins and cytokines. The relationship is bidirectional. Recognizing this, we can encourage patients to use stress reduction strategies to support their immune health. Physical assessment completes the picture. Inspect skin and mucous membranes for rashes, lesions, or purpura. Palpate lymph nodes for enlargement, consistency, and tenderness. Assess joints for swelling, warmth, or limited range of motion. Evaluate all major systems for signs of immune dysfunction. Always document any functional limitations or disabilities. In summary, immune system assessment is complex and comprehensive. It requires a detailed history, careful physical exam, awareness of age, gender, nutrition, chronic illness, lifestyle, and psychological health. By integrating all these factors, nurses can identify immune dysfunction early and guide patients toward interventions that strengthen their defenses and improve outcomes.